You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. According to my first guest, with us, we have Iowa's dentist, Dr. Mohan. Dr. Mohan, welcome to the program.
Hi, thanks.
So I have a lot of questions about, and we're talking about mini dental implants today, or dental implants to secure a denture or a fixed set of teeth in their mouth. But for people that don't know you, tell me a little bit about your practice, who's your typical patient, and what are the different procedures you do?
Yeah. Great. No, we're in West Des Moines. We love where we are. We're right on Jordan Creek Parkway. It's really easy for people to find. And there's 3 dentists in our practice, which is really kind of nice. It's kind of a nice size. And we have...
Do they do certain things you don't do? Or?
They do, yeah. They do more general dentistry, more fillings and crowns and bridges and root canals and all the, fun things.
Okay.
And so, but we complement each other. They do certain things, and then I do other things, and so then we.
So what do you focus on?
Yeah, I focus on implants in my practice, mini implants and conventional implants, and also Invisalign and 6-month smiles. We also do a lot of sleep apnea. So dental appliances for sleep apnea, so people that wear the big giant CPAP machine over their face.
You say that you've actually taken people off, people that were wearing CPAP machines.
Yeah, they love it. They love it.
Really?
Well, people describe a CPAP machine as being like sleeping in a tornado because it forces wind basically into their face, and so a small dental appliance compared to that is just a dream for them, so they love it. So
okay, and you're pretty, as far as technology in your practice, you're big on technology.
We are. It helps us help so many patients. It's great.
So like what, where it benefits the patient?
So one of my favorite things is the intraoral camera, so inside the mouth camera. So we can give patients a tour of what's going on in their mouth and they can see, they can really tell, oh, well, that tooth doesn't look right. What can we do? And so we save a lot more teeth. So
like on a screen right there.
Yeah, we put it up on a big screen. And we save a lot more teeth because people can really see what's going on and they can tell that something needs attention, and that way we can help them. Yeah.
Okay, and so like digital x-rays.
Yep, digital x-rays, and gosh, all sorts of things that just really, even the sleep appliances, that's great technology.
Do you do pretty much everything though? Under one roof?
A good part of everything we do.
And dental implants are a big part of your practice.
Yeah.
So who's coming in for that?
Oh gosh.
Younger patients, older patients?
Everybody. We see all sorts of patients, a lot of older patients, but certainly lots of younger patients. Lots of younger patients that are just missing one tooth and they want a solution for that. But a lot of denture patients. My favorite are denture patients that really, it totally changes their life because they can eat, they can chew, they can smile, they can laugh without worrying that their dentures are going to fly out of their mouth. And that's not a good social situation to be in when you're afraid to laugh.
Good,
yeah. Good.
Now we invite you on the program, and you're here in California with our program that airs all over the U.S. and Canada.
Right.
But you're lecturing.
Yes.
So you lecture, I guess, all over the country.
Yeah.
Tell me a little bit about that. A little bit about your background and training. But what are you here for?
Well, I'm here. I spoke to a group about temporomandibular joint disorders, so we call it TMD just to make it a little easier, and headaches. So we do TMD and headache therapy in our office to get patients relief. A lot of times they've been everywhere. They've been to the ENT doctor, the chiropractor, the acupuncturist, the neurologist, like migraine headaches. Yeah.
You've seen women that have had migraines for years, and they're gone.
And men gone,
really?
Cured. Yep, it's amazing.
I'm very skeptical about that.
Are you?
Particular.
Yeah,
but
and
you see it.
And if I hadn't seen it, and it's a system that a lot of times before we were doing a few things to help our TMD patients that also had a lot of headaches. It's completely different. It's a whole system. It's designed to really work out all of the cause of the migraines instead of just give it medication and make it feel better.
So let's start then with mini dental implants.
Yeah.
Who's the typical patient, and what are the different categories of patients that would be candidates for this?
So what's great is, implants essentially, I think of a dental implant as anytime you're missing a tooth. So a mini dental implant can replace one tooth, it can replace all of the teeth, or a lot of times people with dentures, it can just make their dentures super solid and secure so they stay in and they don't
So when we say no more dentures at the top of the show, no more traditional dentures.
Right.
You think that's the future of dentistry? That means in the future they'll be gone?
I hope so. Wouldn't it be great if people didn't have to go walk around without teeth? That would be so wonderful.
So they'll always be latched onto something, you think, in the future?
Yeah, I think so.
And that's happening in your practice?
Absolutely.
Now, why is it what used to take, I guess, a long time, 9 months,
Yeah.
6 months, can now happen in one day?
Yeah,
or
it's
in a few
technology.
visits?
It's technology.
What's changed, though, specifically?
I think, I mean, the titanium that we use, it has different coatings. It's just a better material. So, and the research has come so far. We've kind of shed the things that don't work, and we accept the things that do.
So in your town, let's say within an hour,
Yep.
are there a lot of denture wearers?
There are
Like
lots
thousands of them?
people. I would say thousands of them. There are a lot of people that just, and this goes back to just dentistry in general. A lot of patients just, they would rather do about anything than go to the dentist, right?
That's true.
And so they've avoided the dentist, and that's how they've lost teeth. I mean, I know people think the dentist is a bad thing, but we do save teeth. We help people.
Do you
to
hear
keep
that
their
every day,
teeth
by
for
the
a
way?
lifetime.
Because nobody likes going to the
Every
dentist, right?
day,
What do you
every
say to
day.
that? Well, and how do they say it? Like,
You know,
no offense,
you know what
doctor?
usually they do. They say, no offense, but I hate you. Sometimes, yeah.
Okay, good.
But they say nice things. I mean, you know, I'm glad that you're here to help, you know, when I need it. But I always tell people, I said, there is going to come a day in your life when you're going to need a dentist, and you really want to know somebody on a first name basis when that happens. So we're here to help people, but I know people don't want to take advantage of that a lot of times because they're scared. They had bad experiences when they were young, or they just have never had anybody that listened to them or really cared. So it's nice. That's why people lose teeth. It's not because they're not taking care of them most of the time and that type of thing. It's
So they
because
put it off, especially men, right?
They put it
We
off.
wait and wait.
I know. What is it about men? Why do you do
Well,
that?
we don't like to go to the dentist too, right? We just wait.
Or the doctor or that kind of thing. I don't know.
Yeah. Yeah. So if it says, okay, so you have thousands of people,
Yeah.
upper or lower denture,
Yeah.
and you're saying with a small amount of mini implants, they could get a full arch of teeth
Yes.
that snaps in,
Yes.
snaps out, no more adhesive. If it's so good, why aren't they all doing it? That's my question.
Well, I think there's a lot of things. I think a lot of people don't know about it. A lot of people think that it's very costly, and so they avoid just even having the discussion about cost. But that's an easy thing. You know, I mean, how many times do you go and you know, write a check for your car? And everybody finances things, you know, over time,
Okay.
and we expect these to last the rest of their life. So there's really no reason that you wouldn't, you know, stretch that out for
Seems
a
painful
while.
though. I mean, it's got to be painful.
That's probably when I started doing this, that was the biggest surprise, because people expected it to be very painful and they go home and it's not.
Do they say this on the consult? I mean, do they say that? I mean, is that one of the
Yes.
frequently asked questions?
Every time I see a patient for implants, I always say people have concerns about cost. They have concerns about their fears, what's going to happen, and certainly pain is probably the top of the list. And then they just want to know what's going to happen. You know, what's my day going to be like? What will I feel like when I go home?
How soon can they eat, by the way?
Most people go home and do something fairly reasonable that day.
Is that right?
Yeah.
They could eat right away.
Yeah.
So if somebody's watching this, okay.
Yeah.
And in a perfect world, okay. So 70-year-old, because you say, you know,
We don't live in
70-year-old's
a
young
perfect
today.
world.
But in a perfect world, that means medically they
Right.
come in. How soon can they get a full arch of teeth?
Well, most
If everything
of the
works
time,
out right.
within a few weeks, usually. I mean, just from start to finish.
And they're
It's
never
pretty
left
fast.
without teeth?
We try really hard to never leave somebody without teeth, unless they have a situation where they don't have teeth now and we have to build them. No, yeah.
Okay, so you mentioned fear of pain, fear of expense. It keeps these denture wearers from coming in. What else?
Right. Well, a lot of times when people have their teeth out and they get dentures, they think they're just done with the dentist. They don't have to come back, which in some situations that works for people, but most people are still pretty miserable with their dentures.
Really?
So, yeah, they do. And they think, well, a dentist can't help me because I'm done. My teeth are out. So then when they
So
come
they don't
back,
know their options.
They don't know their options, yeah. So, and we don't have a lot of denture patients in our practice because we save teeth. And so then, when we talk to people that don't have their teeth and they have dentures, then this is a great option for them.
In all areas of dentistry, because I mean, you do a lot of
Yeah.
stuff there. Is this one of the, I think you told me on the telephone.
Yeah.
This is one of the happiest group of patients.
Yeah.
Why? Why is that?
Because it's such a change from going from no teeth with dentures to implants with dentures. Huge difference, huge.
Okay, and there's
Yeah.
a difference between small diameter implants or mini implants and regular traditional dental implants.
Yes, it's
and today we're talking
faster.
about the mini implants.
Right, it's faster and lower cost.
Like a lot less,
A
right?
lot
Like
less.
75% less.
That would be fair.
I mean, traditional implants could be $20,000, $30,000.
Absolutely.
Is that right?
Yeah.
And we talked about in the green room. You say not everybody has that kind of money to put in their mouth.
No, of course not. I mean, that's a car. So
And you do both, right?
We
you
do both.
You do both
yeah.
procedures.
So a lot of the different categories of patients, we have patients that, yes, are missing all of their teeth, they have a denture, they kind of feel like they're getting along okay with their denture, but they really would like to do a lot better with it. And it's life-changing for patients. It's not a small thing.
But I know a few denture wearers, at least. I never hear them complain.
Right.
So is there such thing as a happy
Well, I think there are
denture
some
wearer?
people that just never complain.
Okay.
But then most people are pretty happy with an upper denture. The upper denture feels pretty good. It feels pretty natural. It has suction up into the palate, so people can wear them pretty well. The lower denture doesn't have any place to really rest. It kind of floats around and moves quite a bit for people. We do probably 10 times more lower dentures than we do upper dentures because there's so much. It's such a bigger change because the lower dentures really, people like their upper dentures, they don't like their lower dentures.
Is there a tipping point for a lot of these denture wearers where they finally come in, they go, I got to do something? And what are some of those reasons?
Some of the reasons are they go out for dinner and they just can't eat the food that they want to. I have patients that say, I can finally eat pizza again, and I haven't eaten pizza for years and years. Or I really want to eat corn on the cob, at state fair time, or steak or something like that. And when those dentures are really secured with the dental implants, they really can. They can eat most of everything that they want to. So it's a huge difference.
What about age? How old can you be to do it? What's your oldest patient?
90.
90?
Yeah.
Why would a 90-year-old want to do this?
Because they still are living.
Okay.
They want to feel good. And you know what? They can. I mean, there's
and they don't fall out even at 90 years old?
There's
That seems
no
kind of
restriction.
risky.
They still have bone. They still have something to put
Is
in
it more painful for the 90-year-olds?
No, I think they're tougher. Yeah.
So the bone, it doesn't matter.
Absolutely.
A 90-year-old can do this.
Yeah, absolutely.
Are there people, though, that you think self-diagnose, they go, I'm too old for dental implants?
But no, I think they do that. I think that's important to know.
Old.
Yeah, they think they're too old. So that's not a restriction at all. We have a lot of older, really healthy patients that, they'll have their dentures for another 10, 15 years.
Okay. Now, what about people that say, my gums are too bad, I can't get dental implants?
Right.
Is that true?
No, because once the teeth are out, that really takes care of the gum problems that they had before when they had teeth. So that's not an issue at all. We get patients that have had trouble their whole lives and they're okay with their dentures, but they know there's something better. I want to back up for a minute and talk about what really is the tipping point for people, what makes them want to do something like this.
Okay.
It's a lifestyle change. It's something that they have, they have they're dating or they do speaking. I have a lot of patients that for their job they have to go talk in front of groups, and so they don't want any possibility that something is going to come loose, or that they just really want to feel confident and secure.
Can you make them look cosmetic? Because I feel like I could spot a denture walking down the street.
Yeah, I have patients all the time that nobody can tell that they have a denture. Unless you told somebody, you really shouldn't be able to tell that a denture is.
Do you do a lot of this in-house?
Yeah.
In your office, as far as making the teeth?
We do a lot of the steps in our office. We have a phenomenal lab that does the dentures. So yeah.
So they can eat, and you mentioned steak, so they can eat the right.
Plus, when somebody has an upper denture with implants, then we can cut the palate out of it so they can taste again. That's a big thing for some people. I had a patient that came in and he wanted to taste beer again. So he said, I can't taste beer. The plastic's in my palate and I can't taste it. So we do implants and then take the palate out and people can taste again.
Now, okay, so let's talk a little bit about the options then for the denture wearers.
Right.
Okay, so with mini implants specifically. Okay, so they come in. What does that consultation sound like as far as options?
Well, a lot of it's just finding out what people really want and what they need. And everybody's different. And so that's where the listening part comes in. I think a lot of dentists assume that I know what you need. And I don't ever assume that. I want somebody to tell me what they really want and what their goals are. And then that's what we find out in the consultation. That's really important because otherwise, if I don't know what they really want, how am I going to give them what they really need, and what they want?
On the consultation, how soon do they find out if they're candidates? How soon do you tell them this is my recommendation?
That day.
Oh,
yeah.
is that right?
Yeah,
okay.
We pretty much know right away. There are a few people that we kind of need to collaborate with our lab and just see if everything makes sense, what their goals are and what I can do for them, they line up.
Here in California, it's about 50-50 when it comes to free consultations and paid.
Yeah.
Do you offer free consultations?
We do, and the reason is I want people to be very sure before they have to write a check that they want us to take care of them.
Okay.
Yeah.
Now, what about people that don't have enough bone?
Yeah, there's a few. It's not very common, especially that's what's so great about mini dental implants is that the bone, you don't have to have this massive amount of bone to be able to do it because they're smaller and they don't require as much bone.
Have you ever
That's
had a
huge.
patient that told you they were told elsewhere?
Many
not enough-
times.
Many a time?
Very, very often.
Really?
Yeah, because most people are trying to fit a big, giant, you know, peg into a small area, and we're trying to fit a small implant into whatever bone they have existing. It's very, very
So
common.
when you said all the time, okay, so patient, and I know you want to be positive
No,
on the show,
yeah.
but there are a lot of patients out there then in your neighborhood.
Well, that just haven't been given hope. They haven't been given
They were
hope
told
that
you
there's
can't do
something. They were told that you can't do it. And what they're really told is that you can't do it the way I do it. You know, the way that the dentist that they saw does it. So we have a lot of different options. So we
because
can
not
help.
everybody does mini dental implants, small diameter implants. Is that right?
It's not very many people at all. Well, traditionally, when implants first came about, the small diameter implants didn't exist. And so when they came out, everybody thought, well, those won't work. That's silly. You need to grab a lot of bone and you need to really put something big in there to anchor. And the research is at least 10 years old now. And they just come out with this great study that's 10 years old that these things work and they're great. And
So if I talk to one of my buddies
Yeah.
who might be a periodontist or an oral surgeon, which I have,
Right, yeah.
they say, Randy, I don't want to do the mini.
right, I don't want to
There's
make
not enough
anybody
research
mad, but
out.
at the same time, I mean, the research is really clear.
So they work.
Yeah, yeah, absolutely.
And so what do patients say when it's all done, by the way?
You know, I'm glad that
Like
you
what are
asked.
some of the things?
No, I'm glad that you asked because the main thing that people say is that was so much easier than I thought it was going to be.
Really?
Mm-hmm. Yeah, which is fun. I mean, because I mean, as a dentist, I never want to feel like I'm inflicting pain on anybody. I want to feel like I'm helping. Actually, I have a funny story about that. We went, my whole family went to do a mission trip in the Dominican Republic, and this is the poorest of the poor people. And my oldest son was, I think he was 11 at the time, and so he came up to me in the middle, and he said, Mom, I could never do what you do. And I said, oh, of course you could, honey. Thinking, you know, you'd be a great dentist. Of course, you're my kid. You'd be a great dentist. And
Okay.
he said, no, I could never hurt people like you do.
Interesting.
So, and I said, well, we're actually here to help people. And I think they perceive it as we're helping them. So, yeah, it was just what he saw. It was kind of cute.
So obviously more people would do it if they knew.
I think so. I mean,
So every denture wearer would do it.
I think they
Do you
would
think
if they
really?
could. I think so. Yeah,
Do they ever say, I wish I would have done this years ago?
all the time. I think people say, I wish that the minute that I had my teeth out, I had done something like this. And you know, I have patients that come in and they say, I regret that I didn't take care of my teeth. I wish that I had my teeth back. Well, clearly this is kind of a way that they can get their teeth back. But I have a great example, a patient that she was starting her own business and she had, this is kind of hard to explain, I guess, but she has a gag reflex. So she had a hard time wearing her dentures. So taking the palate out of her upper denture was really important to taking that out.
Mm-hmm.
And so once we had put the implants in her upper and lower underneath her dentures, and this was a young woman. I mean, she was in her late 30s. She was very young. And she had the confidence to go out and start her own business. And she said, I want to be able to talk to people and feel like I know, you know, that my dentures are going to be secure and they're not going to go anywhere.
You could also give people a fixed set of teeth.
Yes.
Is that right?
Yes,
So with the
absolutely.
small diameter mini implants,
Yes.
so a full arch of teeth?
Yes,
With
that
how many
don't come
implants,
in
for
and out,
example?
that-
So for
that stay
example,
in.
let's talk about that. I mean, how many implants?
You can do it with as few as 4 to 6.
Okay.
You know, I mean, obviously more is a little bit better in that situation, but
With mini implants, about 10?
yeah,
8? 10?
yeah, 8 to 10 is really, really, really good for.
Isn't that what
fixed.
everybody wants, though? I mean, something that
Yeah.
doesn't come in and out?
Everybody wants the best that they can get, obviously. Yeah.
Okay. And upper, same thing? Like
Same
8 or
thing.
10?
The bone is a bit softer in the upper arch, so we need to do a few more implants usually in the upper arch.
Now, the part I'm not getting is why it doesn't hurt, because it seems like it would hurt.
That's the biggest surprise that patients have with it because, I mean, besides the cost being lower than they think it's going to be, and they go home and they usually go home taking ibuprofen or Tylenol. I mean, it's very, very.
So during the procedure, it doesn't hurt, obviously.
It doesn't. No, we
Okay.
get them very numb so that they're comfortable. And I don't like to ever work on somebody that is in pain. That just bothers me. It probably bothers me as much as it bothers them. But the most important thing is that the procedure is almost non-surgical. I mean, it's very simple, and there's no blood loss or anything like that. It's very conducive for the patient to feel good the next day.
So when you hear, though, that a dental implant procedure could be very painful,
Right. And they can.
Is that because what? There's stitches.
It's because there's stitches. Because the only place that there are,
But you're not doing
nerve
stitches,
endings,
right?
we don't do stitches
Okay.
9 times out of 10. The only place that there are nerve endings is in the gum tissue that covers the bone. The bone doesn't have feeling. It's the nerve endings are not in the bone.
So these mini implants, I mean, they
they're in
just
the gum
poke right in
tissue.
there.
They do.
And then the bone, what grabs on?
It does. The
that's
bone
it.
actually grows into the dental implant. It actually has, it's called osseointegration, which is a big long word that means the bone and the implant fuse together. So they're not going anywhere. They're going to stay there for the rest of the patient's
And you
life.
lecture on this topic,
Yes.
teaching other dentists how to do it.
Yes.
What are the dentists, what do they need to know about this? When you're lecturing,
Well, dentists are
they
always
skeptical?
Okay, so of course I love dentists because I know so many of them and some of them are very good friends of mine. But most of the time, dentists are really concerned about not hurting their patients. They want to do the best thing that they can possibly do, and they want the patient to not have trouble down the road. So we're very careful about what we do for our patients because we want to make sure that it really works.
So it will last. I mean, it could last. I mean, what's
Yes.
the longest mini implant out there, word on the street?
Probably 30 years. I mean, it's a long, long term.
Really?
Yeah, once they're integrated, they don't come out unless the patient fails to take care of things down the road. I mean, they do have to be brushed and maintained, and you have to go to the dentist and have them cleaned.
So no more dentures,
So,
no more traditional
denture.
dentures.
No more dentures.
And is that a tough, because I guess like you said,
Yeah.
denture wearers don't go to the dentist anymore.
Right.
Is that a tough patient to reach?
Can be. It can be.
But you want them to come in, free consultation,
Absolutely.
find out if you're a candidate.
Yep, sit
Do you
down
do
and
some
talk.
imaging, obviously, for those?
Yep, we do.
And that's included?
Yeah.
And do they get to meet you?
Yes.
All right. And then, and you say like in 3 or 4 weeks they could
have solid teeth again.
could you use their existing denture?
A lot of times we can. It depends. A lot of people don't like their existing denture, so we do make a lot of new ones. But yeah, we use.
How important is the smile? You're a dentist. Of course you think it's important. Because you see
I
a lot of these people
do.
don't smile because they don't like their teeth.
I do,
or
but I
dentures.
think before I saw patients really suffering from these types of things and they didn't want to talk, they didn't want to laugh, they didn't want to smile, they didn't feel confident, I don't think I thought it was as important as I do now. Of course I think it's important, yeah.
You see personality changes?
All the time. I see patients that tell me they make more money because they were more confident. I had a patient.
Really?
I had a patient that came in and she said, "I love my smile. I'm making twice as much as I was before because I feel great."
So you're excited about this. I mean, you really think everybody needs to do it. Every denture wearer would benefit. Would they all be better
No
off?
question.
Really?
No question. Of course. I mean, would you rather have something that stayed in place and was secure, or something that could fly out anytime you talked or laughed? Or
But
patients,
in this economy, why do it?
studies always show that what people really look for in a job interview or when they're dating, that the smile is in the top 3. It's really
Yes,
important.
good
It's
point.
not just. I mean, you can ask my opinion all day long, but
You're
go
a
ask
dentist.
everybody else's. Yeah, of course. I mean,
Smile's
of course, I
important.
think it's important, but it just allows people to be who they are. It allows their personality to come through. It allows them to feel secure and confident and happy about their smile. I mean, all the time patients come in and they talk like this
Do they
because
really?
oh yeah, all the time. And because they're just, and even sitting in the dental chair, you'd think, well, of all places they'd feel like we are not going to judge, what they look like. I mean, we've seen it a million times. And they come in and they talk like this because they can't get, they're so insecure with how their teeth look and how their smile is.
Do you ever
And they
hear-
don't have a smile. They don't smile.
Do you think there's people walking around where you are, where they're perceived as moody
Oh, sure.
or depressed when in fact they're hiding a smile?
Right. I think there's
Really?
a lot of that, don't you?
I don't know.
Yeah. I think it's very,
interesting though that
yeah.
you're saying this.
No, I think it's very, I think when you see people that have a huge, genuine smile that they really just can be themselves, there's nothing like it.
It's like charisma. When you're out and about at dinner, can you spot people that you think are embarrassed of their smile?
I think so.
You can?
I think so. And it's the first thing I notice, of course. It's kind of a job hazard. So
You see there's
Yeah, but-
hiding a smile or whatever.
yeah, but I think it's important, and if it's important to them, if it's not important to them, they should keep their dentures and be happy with it. That's good.
So
Because like you said, there are people that are very happy with their dentures, and that's great.
do you think that if there was such a thing as a try-in period, like, hey, everybody, denture wearers come in, try it over the weekend.
Yeah.
Do you think anybody could go back to their loose-fitting denture?
I don't think that would ever happen. I would say 100% of the time they would keep their tight.
So everybody
dentures.
likes it better than their denture.
100% of the time. Yeah, never had somebody that is unhappy.
So a lot of referrals. I mean,
Right.
they will tell their friends that have dentures.
Right. I get a lot of older patients, of course, we talked about this, and that they go to their coffee group and then they send their friends in because they know that they'd benefit from it. I mean, there's no downside to it as long as they feel comfortable with the rest.
Now you said, and I'm going to talk to you about, because people need to know, these are not to be confused with traditional dental implants.
Correct.
These are small diameter implants.
Yes.
You say that they work, that they're effective, meaning you could chew on them, you could eat on them, they don't fall out all the time.
Right. Well, and I didn't pioneer this. You know, I mean, it's research shown that they work. It's
but
not
statistically
just me, so that's great.
against traditional dental implants.
Right. Very comparable. Very
Same
comparable.
thing. As far as lasting.
They
in
are.
the mouth.
Yep. Once they integrate into the bone, they're there for life.
And they could eat maybe the next day. How soon could they start eating like maybe fibrous foods or salads?
Right away. Yeah, they'll be very comfortable eating within the first few days for sure.
Do they tell you their eating stories when they come back sometimes?
All the time. Yeah. The people like to tell me what they ate the first couple meals, or what they're dying to try, and they'll tell me that before we put the implants in. I just want to eat steak, or I just want to eat pizza, or I just want to eat, I just want to chew without, choking on my food because I can get it in smaller pieces and smaller bites. And
now,
I don't want to cut it for, half of the meal and then eat.
Is this true that with dentures, it's kind of like a cow, that you're really not chewing? You're rubbing the...
Yeah.
You're not really chewing.
Yep, not really. Yeah.
Can you chew with these? So you can actually tear food and chew?
Yeah, you can actually do what you should, because they're solid. They're in there like regular teeth, so you can chew.
And what's the cleaning like? And I'm talking about for the fixed set of teeth. Okay, so you get a full arch of teeth with mini dental implants. How often do they have to come in? And how do they take care of them?
The same as a regular set of teeth. You would do the same thing. You would see your dentist at least a couple times a year to make sure. I mean, it's a pretty decent investment for a lot of people, so you want to take care of it. So you want to make sure that you're seeing your dentist and warding off any potential problems.
And insurance, Medicare, things like that don't cover the whole procedure.
Not normally. It depends. There's so many different plans and policies.
But you offer financing.
Absolutely, yeah. We try and make it as easy as possible because people don't know exactly what, so that it's our job to help them with that.
Okay, so somebody watching this, and we're out of time. Good job, by the way. It's very interesting. Denture wearer that's watching this.
Yep.
But they're still afraid.
Sure.
They're still skeptical. Maybe they think they're too old.
Sure.
What do you say to them? What's your message?
The main thing is, come in, we'll have a conversation about it. I invite people in to just chat.
Costs nothing. Might as well go in, right?
Absolutely, yeah.
Go over the fees. Well, thank you so much for coming in.
Thank you very
interesting.
much.
Very
Thank
interesting.
you.
And we're also going to have you back to talk about some of the other things you do with the adult orthodontics and fast braces. Right?
Yes.
You don't have to wait for 2 years.
Correct.
On the braces you're doing. So thanks again. Very interesting.
Thank you.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can visit our website and just put in Dr. Mohan or a dentist, Iowa, and you'll find her there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.